Ever wondered why your Rottweiler might be acting a bit off lately? Could it be a health issue? Well, understanding common health issues in Rottweilers can certainly help us get to the root of the problem. Today, we're going to take a deep dive into one such issue that is common among this breed, hip dysplasia. By gaining a better understanding of this condition, we can provide the best possible care for our four-legged friends. So, what is hip dysplasia? Let's find out. Hip dysplasia, a common condition in Rottweilers, is a skeletal condition where the hip joint doesn't fit together correctly. It's a bit like trying to fit a square peg into a round hole. It just doesn't work well. Imagine, if you will, a Rottweiler in full stride. It's a thing of beauty, right? Now picture that same dog struggling to get up from a nap, or having trouble climbing stairs. It's heartbreaking. These are some of the symptoms of hip dysplasia. This condition can manifest in decreased activity levels and loss of thigh muscle mass. You might notice your Rottweiler having difficulty walking or running, or refusing to do activities they once loved. It's not that they're being stubborn or lazy, it's because they're in pain. But what causes hip dysplasia? Well, there are three main culprits. The first is genetics. If your Rottweiler's parents had hip dysplasia, there's a chance they could pass it on. The second is diet. Overfeeding can lead to rapid weight gain, putting more pressure on their joints. The third is rapid growth. Rottweilers grow rapidly, and sometimes their bodies can't keep up, leading to a mismatch in the hip joint. In essence, hip dysplasia is a complex condition influenced by a combination of genetic and environmental factors. Now that we know what hip dysplasia is and its causes, how does it affect our Rottweilers? Hip dysplasia can greatly affect your Rottweiler's quality of life. This condition, if left untreated, can lead to painful arthritis, reducing your dog's mobility and zest for life. It's like a snowball effect. The less your dog moves, the stiffer and more painful the joints become, leading to even less activity. As your Rottweiler moves less, you might notice changes in behavior. They may become more irritable, or their appetite might decrease. These are all signs that the condition is progressing and causing discomfort. Hip dysplasia is not a static condition. It can worsen over time if not addressed. The hip joint may gradually deteriorate, leading to a complete loss of function. The pain and discomfort can become so severe that your dog may struggle with simple activities like walking or even standing up. Hip dysplasia sounds scary, but what can we do about it? Is there a treatment? Yes, there are treatments available for hip dysplasia. Now let's talk about the various methods that can be used to manage and treat this condition. The approach to treatment can be as individual as your Rottweiler itself, often depending on the severity of the condition and the dog's overall health. In severe cases, surgery may be recommended. There are several surgical options, each with its own pros and cons. Some procedures aim to alter the joint to reduce pain, while others may involve replacing the joint entirely. It's important to have a thorough discussion with your vet to understand the best surgical option for your furry friend. But surgery isn't the only route. Physical therapy can be a powerful tool in managing hip dysplasia. Gentle exercises can help strengthen the muscles around the hip joint, improving stability and reducing pain. Hydrotherapy, in particular, can be beneficial, as it allows for low-impact exercise. Medication, too, plays a key role. Anti-inflammatory drugs can help control pain and swelling, while supplements such as glucosamine and chondroitin can support joint health. Remember though, any medication should only be given under the guidance of a veterinarian. Now, let's not overlook the importance of a balanced diet and regular exercise. Maintaining a healthy weight is crucial, as excess weight can put additional strain on the joints, exacerbating the condition. A diet rich in omega-3 fatty acids can help reduce inflammation, while regular, low-impact exercise can keep those joints moving without causing undue stress. One thing to keep in mind is that treatment for hip dysplasia is often about management rather than cure. This means that even with treatment, your Rottweiler may still experience some symptoms. But with the right approach, these can be managed effectively, allowing your four-legged friend to enjoy a good quality of life. With knowledge and care, we can help our Rottweilers live a happy and healthy life, despite hip dysplasia.